Um, so everybody's here. Everybody has come back. I can see the only 13 people is here. I just wanted to complete this concept of biomarker and surrogate endpoint before we move to the clinical discussion. Shall I continue?
Yes, sir.
Okay, so in this setup now, when you have the evidence that you can use, you can infer or you can conclude if the BP is less than 140, there is a decreased risk of stroke. If you have this evidence and you are using antihypertensive drug to decrease the BP less than 140, then can you conclude that can you conclude that there is a decreased risk of stroke if you are giving this antihypertensive and the BP is less than 140? You conclude that?
Yes, sir.
Yes, very good. For example, now if you use anti-osteoporotic drug and you cannot wait for a long time to see the effect, to see the fracture rate after giving a drug, and you are simply using a bone mineral density (BMD) to assess that, can you conclude that okay, there is a reduced risk of bone fracture?
Yes, sir.
Yes. Similarly, if you are using an anti-diabetic drug, sorry, I have an example of lipid lowering drug you are using, and if there is a reduced cholesterol over a long period of time, can you conclude that there is a less risk of coronary artery disease?
Yes.
Yes. So what I want you to understand is this is the middleman. Okay, this is the middleman. Um, this, and of course, even this is the outcome that you want to see. So these are like clinical endpoint. Okay, you are seeing clinically. Okay, but these are biomarker or surrogate endpoints. So based on these, you are extrapolating this. Okay, so based on these biomarker or surrogate endpoint, you are predicting the clinical outcome. Okay, so this is what is the concept of endpoint is. Okay, surrogate endpoint and the clinical endpoint. I hope this is clear to everyone.
Yes, sir.
Okay, so now we'll be starting with, we'll see some of the important things over here, and then we'll start with the Emacs model, which is important from your exam point of view. There is a small derivation. So, shall we start this concept now, or next class you want me to? We have 5 more minutes. Let me complete this, okay? What do you say? Hello?
Okay, sir.
Okay, so now we have the PK and PD. We are here talking about the relationship. We'll see this relationship in terms, and you know the PK parameters are like Cmax, AUC, all those things, and you have the PD parameters in terms of response, which is generally response. So let us see some of the particular specific parameters, how it relates to a specific dynamic parameters. Okay, so here let's say the kinetic parameter like Cmax, AUC. Okay, when you these two parameters Cmax and AUC, when you divide Cmax by MIC, okay, what is Cmax? I hope everybody knows. Cmax is the peak concentration, maximum concentration of drug, and AUC is the coverage. Okay, the overall we say area, right? We say that is the overall coverage, how much overall concentration or throughout the time period. Okay, so that is a AUC. So when you divide AUC or Cmax by minimum inhibitory concentration, which is minimum inhibitory concentration is a dynamic parameter. Okay, whereas Cmax and AUC is a kinetic parameter. So when you divide Cmax by MIC or AUC by MIC, you have a very important index. We say PK/PD index, okay, or PK/PD indices, based on which you can infer many important things. Okay, so we'll see that what does it signify. Based on this, you can you can predict the efficacy of a drug. For example, here you can use this indices to say that it is concentrated because Cmax and AUC is related to concentration, right? Hello, Cmax and AUC is related to concentration, right? So you can call it as concentration dependent indices, okay? And you have something called um, T. What is T? T is the total duration of time um, over which total duration of time over which the concentration of drug remained over MIC. So that we represent that by T greater than MIC. You have MIC, you have a curve, you have MIC. So, and the concentration remained over MIC. Okay, so this is a concentration, this is MIC, this is a concentration over MIC. So, for what period of time? For what period of time this concentration over MIC remained? Okay, so let's say 1 hour or 2 hours. So that will represent by T greater than MIC, okay, greater than MIC. And so these indices, now as I told, there are two concentration dependent indices, and or you can say when you use, let's say if you be a little bit more specific in terms of antibiotics. So when we say the potency of antibiotic, that means you're talking about MIC. If the MIC is very less, we say it is very potent. So these are we can kill the micro. That means we can kill the microorganism in two ways actually. There is concentration dependent killing and time dependent killing patterns. So before I dive into this detail of this concept, I want to ask with you one question. Have you ever seen an antibiotic being given in infusion? Infusion.
Yes, sir.
Okay, why do they give infusion over
Yes, sir.
10 minutes, half an hour, 1 hour? They can give in a short, no? This was a query which I was asked by one consultant, BBS actually. That time I was in third or fourth year, I was not knowing this concept. Why do we give antibiotic over a prolonged period of time? We don't want, we are not increasing the dose. Anyway, the total amount of drug is going into the body. Why do we simply prolong it? Are you getting my question?
Yes.
Pashupati, did you get my question? Okay, well,
Yes, sir.
you can defend by telling that okay, this may reduce the chance of anaphylactic reaction, because most of the time we see that when we give a drug in a one shot or very quickly, the patient feel uncomfortable and there is high chances of getting reaction. Okay, I agree to your point. That is in terms of safety. Okay, that is in terms of safety. But have you ever wondered that if I tell you that if you give antibiotic for a prolonged period of time, that increases the efficacy, or that kills the organism more effectively than giving in one shot? Have you ever thought of that? That if you prolong the duration of infusion, the reason we give the infusion over a long period of time to increase the killing effect, to increase the killing effect. So, had you ever thought of that?
But only for some antibiotics, sir.
Yeah, that's what, only for some antibiotics. Again, there are many things that will affect this. We are going to discuss that. But this is what is called time-dependent killing patterns. Okay, time-dependent killing patterns. So this is what I had been telling to you, know that this is how this subject differs. Okay, from other normal kinetic pharmacokinetic subject. So here we are actually understanding, in this chapter we are actually understanding why we do something clinically. You go to the ward, you see they are doing something, but why they are doing, okay, and how it is related to kinetic parameter. That is what you are learning here. Okay, so you see that they are giving infusion, but now you understand why they are giving infusion, what is the effect of that. Okay, so this is important for us, the clinical pharmacists, to understand from kinetic point of view. So we have concentration dependent killing pattern. Um, that is associated with higher rate and extent of killing. If you compare this concentration dependent killing pattern and time dependent killing pattern, this concentration dependent killing pattern have higher rate and extent of killing than time-dependent killing pattern. But you should understand that both the technique helps in both the technique or both the parameter helps in increasing the killing pattern, increasing the killing. Okay. So this is a graph which shows MIC based kinetic dynamic indices. Here you can see for this time period, the T remain, the MIC remain, the concentration remain over MIC. Okay? So and based on these things, you can predict the efficacy. Okay. So this is again another graph which shows you the three parameters as we saw, these two, AUC by MIC and peak by MIC or Cmax by MIC in a concentration dependent killing, and time T is greater than MIC in a time dependent killing. If you see these two, the left two graph, is very clear like kind of relationship. Okay, there is very clear negative kind of correlation, but here we have less correlation. Okay, so that's what I was telling. This concentration time dependent killing is more effective than time dependent killing. Okay, so this is what we call percent of time. This is what happens when you give the infusion at a proper rate. That is called zero order rate, isn't it? When you give the infusion, that if you remember zero order reaction and first order reaction, one of the example of zero order reaction is giving IV infusion from your last year of pharmacokinetic. So this by giving this infusion, it kills the organism at a zero order rate. Okay, at a zero order rate. So that means over a prolonged period of time. And this is how we represent percent T greater than MIC, which is the percentage of time within the dosing interval during the systemic drug concentration that remain above MIC for the drug and pathogen. So there are some implications. This I will talk in the next class, like when we use some kind of antibiotic, what kind of antibiotic is dependent on time-dependent killing, or what different kind of antibiotic is dependent on is using the concept of concentration-dependent killing. Okay, so I will talk that in the next class. And with that, Emax drug concentration effect model will complete. And with this two topic, we will wind up this chapter. I think this chapter is really taking a lot of time.